Good evening everyone. Today, I'm going to show you how to perform a neurological assessment. First, you need to assemble all the equipments like the gloves, cotton applicator, pen light, Snellen's chart, cotton balls, objects to fill, tuning fork, reflex hammer, and gown drape or drape. Second, treat the patient's chart. And next is to wash hands and observe appropriate control procedures. Then greet and identify the client. Good day, sir. You're Albert Angelica.
Yes.
Okay. Mind if I call you Albert?
Yes.
Okay. Next is to introduce yourself and explain the procedure to the client. Good day, I am Nurse Angelica and I will be your nurse for today. And I will be conducting a neurological assessment. The purpose of this assessment is to detect any neurological disease or injury. Monitor its progression to determine the type of care that I will be providing to you and get your response to my intervention. We first perform hand handling. Next thing to do is to provide privacy to the patient by closing the windows, curtains, and doors. I have already closed it. Next is assess the environment, resources, and the client's medical condition on how to systematically complete the procedure. Now, I will be moving forward in inquiring about the patient's medical history. Sir Albert,
Yes.
have you been recently feel or experienced headache, numbness, or tingling?
Recently I experienced a little bit
Experience
headache because of exposure.
too much exposure.
Yes, to the gadgets because of the online class.
Okay. How about the seizure activity?
No.
No. Do you feel any dizziness,
No.
lightheadedness, problems with balance or coordination?
No.
No. Any decrease in ability to smell or taste?
No.
Any ringing in ears?
No.
No. Any change in vision?
No.
How about any difficulties or understanding when someone is talking to you or when you talk to someone? How about any difficulties in swallowing? Loss of bowel or bladder control? How about any memory loss? Tremors? No. Sir, have you ever been diagnosed with head injury,
I don't have.
meningitis, encephalitis?
No.
No. Any spinal cord injury or stroke? Have you undergone any treatments?
No.
No. Okay. Does any member of your family members diagnosed with high blood, stroke, Alzheimer's,
Right.
hepatitis? How about brain cancer? Okay, good. Do you have any prescriptions or non-prescription medications?
No.
What is your cigarette smoking and alcohol drinking pattern?
I don't smoking, but I
Did you drink alcohol?
drink alcohol twice a month.
Do you wear seatbelts or any protective headgear?
Yes.
Yes. What is your daily diet?
In breakfast I eat bread and drink milk. For lunch, vegetable, and for dinner is meat and juice.
Have you been exposed to lead, insecticides, pollutants, or any chemicals?
A little bit of lead because of the pencil.
Okay, pencils. Okay. Do you have frequent repetitive movements?
No.
What are your functional or daily activities?
I exercise every day and I help my mother in household chores.
Next thing to do is to ask about his medical status, ask about the orientation to person, like what is your name?
Albert,
Okay. How about orientation to other people? Do you know him or do you know her?
yes, that is our president, Rodrigo Duterte.
Yes. And next is the orientation to time. Can you tell me what time?
9:30,
9:30. What is your birthday?
May 5, 2000.
Orientation to other people. Next is the memory. And to remove memories, I will ask about the past events that happened in your past life, like birthdays,
Yep.
what
Ayan,
happened in your past.
my birthday. Our family celebrate my birthday. Like, small event lang.
It happens like in the past of your life. And next is I'm going to ask you, any scenarios happen recently, like lately, after you, before you go here? What are the things or the, that you do?
I Yesterday I clean our house and do and take a bath of our dogs.
Okay. This is the general knowledge. Do you know who is our president?
Yeah.
Do you know?
Our president is Rodrigo Duterte.
Okay. And do you know um, do you know the capital of the Philippines?
Yeah, that is Manila.
Yes, Manila. And how about the do you know our Philippine national flower?
Isang pagita.
Yes, okay. So the client shows well known the general knowledge. Okay. Next is the attention span and calculation skills. One is 12 times 50.
180.
180. Okay, 180. After that, the next thing to do is to clearly describe the patient's response to stimuli. Other follows commands and responds appropriately to stimuli. And next is the lethargic, drowsy, responses to verbal stimuli. Next is the Stropurus, requires vigorous stimulation for a response. And Comatose doesn't respond to any appropriate verbal or impulse stimuli. Next is to check his appearance and behavior, the posture and the behavior, dress, grooming, and the personal hygiene, the facial expression, okay, and the effect and the relationship to person and things. Next, assess his speech, check for its quantity, pace, volume, or variety, and spontaneity of speech. Assess his clear and difficulty of performing words. Repeat the phrase and ends, ifs, and buts. Okay. Fluency, articulation of words. Okay. So, can you read this for me?
Genuine,
Genuinely.
grace, judge.
Next is the thought process, thought contact, planning, and judgment. After that, check his cognitive function. First is the orientation and the attention of the digit span. Recite a series of digits starting with 2 at a time and speak each number clearly and then repeat it backwards. So normally, it should be able to repeat correctly at least 5 digits forward and backwards. So can you count starting from 2?
2, 3, 4, 5, 6, 7, 8, 9, 10.
And repeat it backwards.
10, 9, 8, 7, 6, 5, 4, 3, 2.
Okay. So the client can recite the number and can speak it, repeat it backwards. Next is serial 7 in stop repetition to start from the 100. Subtract 7. Keep subtracting 7. Note the effort requires speed and accuracy of the response. So normally, it can. Okay. Now, Sir Albert, can you please subtract 7 from 100?
93,
93 minus 7,
86,
86, and then 86.
79,
Okay, 86 minus 7 is 79, and 79 minus 7.
70, 72,
Okay, 72 minus 7.
and 65.
Okay, so the patient can subtract 100, can subtract 7 to 100 continuously. Next, spell backwards. Say a 5-letter word and then spell it backwards. Now, Sir Albert, I want you to say 5-letter word and then spell it backwards.
Areas.
Yes, okay.
A-R-E-A-S.
Spell it backwards.
S-A-E-R-A.
Okay, good. So, the patient says the word areas and he can spell it backwards. Next is to content clarity. Assess thought content, clarity, and cohesiveness of the patient's ideas. Is there any logical transitions between ideas, hallucinations, sensory perceptions that lack appropriate stimuli? Does he have any delusions, beliefs, or from reality? Next is the Proverbial test. Test the client's ability to think abstractly. Okay. Can you answer this abstract pattern? What should be the next on the triangle? Is a shaded triangle or a plain triangle?
Shaded triangle.
Okay, good. Next is the test judgment. This is how we respond to a hypothetical situation. If you would develop any aspect of yourself, example, strength, intelligence, charisma, but you had to decrease other aspect, what aspect would you increase and decrease?
I will increase my intelligence and I will decrease my charisma.
Okay, next in the mood. Throughout the interview, check for the patient's mood and stability over the emotional responses. So as far as I observe, the client doesn't feel any. The client's mood is not. I mean, it's normal, and he doesn't feel bored. And he also responds to the questions that I am asking. Next thing to do is to assess his constructional ability. Observe the patient's ability to perform simple tasks and use various objects. Okay. Can you form a letter O using your body?
Okay.
Can you form a letter O using your body? Okay, it's letter O. You can follow instructions. Can you spell your name, your hips? Okay. Okay, you can follow it. Okay, thank you, sir. Next is to assess the cranial nerves. Assess the cranial nerves. We have the 12 cranial nerves. First is the cranial nerve number 1, which is the olfactory nerve. I will ask the patient to identify at least 2 common substances. Make sure that the patient nostrils are patent. Make sure that the patient's nostrils are patent. So Albert, can you identify these 2 substances?
Vinegar.
Vinegar. Okay.
Menthol. Vicks.
The patients can identify the 2 substances. Next is the cranial number 2, which is the optic nerve. Test visual acuity using a Snellen chart. We can also use in confrontation using visual. I want you to read each letter in the chart. Okay. So what letter?
C.
And what?
E. F.
Okay. You sit down.
2.
Okay, good. Next is the cranial nerve number 2, which is the optic, and which cranial number 2 is the... Next, expect the pupil and then one side to another. Okay. Next, the test the capillary test to light. Okay. So pupils are retracting and doesn't have any reactions. Next is the cranial number 3, the oculometer. Which is the cranial number 4, the trochlear, and cranial number 6, which is the abducens. Inspect the size, symmetry of the pupils, and the reactions to light. Next is test the ocular movement using cardinal directions. Focus right up, right down, and right up, left down. After that, proceed in the cranial number 5, which is the trigeminal sensory. I will ask the patient to close his eyes and then touch him with a whisk of cotton and forehead, cheek, jaw, and each side. How did you close your eyes? Do you feel it? Next, test is pain perception by touching the patient safety pin. I will ask the patient to describe and compare. Okay. Can you please close your eyes and I tell you to open? Okay. Can you please describe and compare both of the sensations feel? Next is the motor. I will ask the patient to clench his teeth. Okay, I will palpate the temple and the muscle. Okay. Note the strength of the muscle retraction. It should be equal and lateral. Okay. And test the corneal light reflex. Can you clench your teeth while I palpate these parts? Okay. Next is the cranial number 7, which is the the sensory component, which is the taste test. By putting the test in the patient's tongue. Sir Albert, can you please tell me the items that I will put into portion of your tongue? Okay, observe the patient's motor function. I will observe the external symmetry. Can you stick at your tongue? Okay. What's the taste?
Salty
And
sour.
oh yes, sour. After that, I will observe the patient's face for symmetry, and while he smiles, frowns, and raises eyebrows, have the patient to and test the muscle strength attempting to open it. Can you close your eyes? Okay. And this is me from opening it. Okay. Okay. Can you smile? Frown? Okay. Can you open it up? Assess for Weber's test and Ryan's test. Now, Mr. Albert, I will be starting the tuning fork and placing it in the middle of your forehead. Please tell me if the tone is equal in the forehead. Where do you hear the sound?
Sick one.
Normally,
Yes.
the sound is found equal in the both ears. Next is the cranial number 9, which is the glossopharyngeal, and number 10, the valgus. Listen to the patient's voice and any difficulty in swallowing, and ask the patient to say ah And watch the movement. Patient's voice and any difficulties of swallowing. And ask the patient to say ah, and watch the movements of the midline position and the pharynx. Okay. Next, check his gag reflex and warn your patient by doing it. Okay, Sir Albert, I want you to say ah, but first, I will just wear gloves and use a tongue depressor. I will check your gag reflex. I will stick out your tongue and you will say ah, and this might feel choke, but it is just normal. Okay, I will just this. Okay. Good. Next is the cranial number 11, the spinal accessory. From behind, I will ask the patient to shrug both shoulders upward against resistance. Okay? Can you shrug it? Okay. Okay. Which is the trapezius muscle. Note for the stretch and contraction of the trapezius. Now, Mr. Albert, I'm going to ask you again to shrug your shoulder upward against my hand. Okay. You feel any pain?
No.
After that, I'm going to ask the patient to turn his head to each side against resistance. Okay, you will release your hand. Okay, turn. Okay, against resistance. Okay. I am feeling the sternocleidomastoid here. Here. On the other side. On the other side. Okay, as you can see, observe the contraction opposite of the sternocleidomastoid and the movement against the zone. Okay. Do you feel any pain?
No.
Okay, good. Next is I'm going to ask you to turn your head against your hands. Observe the contraction of the opposite sternocleidomastoid and note for the movements against your head. Okay. Next is the cranial number 12, which is the hypoglossal. I will observe the patient's tongue for symmetry. Then I look at the tongue, press tongue and push tongue against it. Okay. Sir Albert, I'm going to push your tongue against your cheek as I apply resistance. Okay, on the other side. Okay, as you can see. Okay, good.